Well, hello, everybody. Welcome to IRG Start or Sit. This is our fantasy football podcast where we talk about last week's injuries. That would be week 7. Who is injured in the NFL, and particularly are they on your fantasy football team? And coming up here, looking towards week 8, are they going to start or are they going to sit? Meaning, is the injury significant enough where they're going to be out or they're going to be able to return to play? And joining me, like always, is Dr. Hawkins, orthopedic surgeon, sports medicine specialist from Olympia, Washington. Dr. Hawkins, how you doing?
I'm doing great today, Shannon. I'm super excited that we're getting a time of year where everybody's kind of doing well. We've got a lot of teams that are kind of, right in the middle of the pack. So I think we're going to have a good end of the season coming up for the NFL. Yeah,
and then it's crazy. We're already talking about week 8, going into week 8. That's middle of the season. I can't believe how fast it is. It's going to be the end of October here, and in no time we're going to be cutting turkey here in no time. And what are we going to do? We're going to be looking at playoffs, and that's what all these teams are really gearing up towards, and everybody wants to get in the playoffs. Some teams have been bit by the injury bug significantly. Some people are staying pretty healthy. Again, I think you and I have talked about this in the past. The NFL is fast, they're big, and they're strong people, and there is multitude of injuries every week, and some are significant, some are minor, and that's what we're going to talk about here today. And starting off for us, kind of feel bad for this guy here, to be honest with you, Deshaun Watson. He's been kind of trying to make a comeback at Cleveland, and I saw a replay this weekend of this injury. He's got a torn Achilles, and when you watched it on replay, I don't know if you saw it, Dr. Hawkins, but you could see the energy just burst. I mean, not to make light of it, but there's a lot of energy in that Achilles tendon. And when they showed it in slow motion, you could see the calf muscle just rip on. I'm like, torn Achilles tendon. Let's talk about that because he's out for the season. Let's chat here.
Yeah, you called it perfectly. Some people who follow the NBA will remember when Kevin Durant tore his Achilles. They had a lot of, footage of that as well. And it was that idea that you saw that sudden release of tension, and you saw the muscle in the upper part of the calf just pull up. So, these are devastating injuries. Your Achilles is sort of that main connection between the gastrocnemius muscle in the back part of your calf and then your heel. So you need it for any type of pushing or planting. And unfortunately, these injuries start to crop up, not just from the speed and the size and the contact that these guys go through, but getting older. And this is probably that classic example where Deshaun isn't as young as he once was. We know that as you get older, the collagen fibers, which are normally parallel linear things, start to become more disorganized. They become a little more haphazard. And so this eccentric load where essentially the tendon's being stretched, and then suddenly either the weight of the person or the weight of the player pushes in the opposite direction, it just suddenly fails. And so these injuries, they require surgery. All our listeners out there have probably followed, we've got Kirk Cousins and Aaron Rodgers back this year, but substantive recovery. He will get surgery for this, and he's at a point in his career where it's plus minus on whether he's going to get a chance to get back to be a starter in the league.
Well, and if he does come back, with surgery, if it happens, sometime soon, probably already has happened. Maybe, I don't know. I didn't really find that in the literature, but he's leased out all this year for sure, and potentially could come back for spring ball next season. You're talking 2025. That's fair to say, I think, isn't it?
Yeah, 100%. They'll probably, like you said, if they haven't fixed it yet, they usually try to get on this in, 7 to 10 days or so. And, essentially there's a couple different ways they do it, but some type of minimally invasive way with sutures to bring the ends of the tendon together and maybe reinforce it with some anchors into the bone if it's a low tear in the tendon itself. But you're right. He's going to be in a boot for, a good 6 to 12 weeks and working on his PT and his his flexibility, but not doing anything strengthening-wise for several months. So you're absolutely right, Shannon. It'll be maybe ready to start doing reps in training camp next year.
Yeah, the good news is, I mean, we've talked a lot about the advancements in just technology and information and research, et cetera, et cetera. And this Achilles tendon has come a long way as far as repair goes. And right now, if it's in the right place and it's actually the mid tendon tear and not an avulsion off the bone, they're using this the technique. I'm sure it's been around a little while, but I mean, it's kind of been in the news lately because that's what they did with Aaron Rodgers. I think Kirk Cousins is a bridge technique. Do you know? I mean, are you using that? Have you seen that? Do you know what do you know anything about that? I mean, it's
essentially a way to sort of reinforce your repair, and the idea behind it is there's some interesting anchors and suture material that can take up a lot of tension, so you can be a little more aggressive with rehabbing somebody. You used to have to worry, obviously, when you brought the soft tissue together with stitches to hold it, is how well, because the end of these tendons, Shannon, they look like a mop end when they rupture. It's not a nice, clean end. It is like it stretches and then it pops. And so it's not like putting a jigsaw together where the pieces fit perfectly. You kind of smush the ends together. And so when that's just suture, you used to have to put them in a cast for 6 weeks.
That's right.
Not move them at all, and keep their foot down in plantar flexion to take tension off of it. And they got so atrophied, they got so stiff.
Yes.
And it took a long time. So the advancement has allowed that early rehab to allow the rest of the tissue to maintain its elasticity and everything else. So you're right, Shannon. They've come a long way with it, and we do integrate all of those techniques now to really rehab even the non-athletes much quicker than we ever did in the past.
Well, it's amazing. I mean, I really enjoy talking to you because you're in that. You're diagnosing it. You're also treating it and repairing it. But when you repair it, you guys, as orthopedic surgeons, you guys are repairing it not just to get it repaired immediately, but you're repairing it for the future. And for our listeners to understand the force and the energy that goes through the Achilles tendon, because that tendon is a large tendon. It's connecting two big muscles to the heel bone. And it's pretty amazing. And when you're doing that, you're trying to also identify what we call length tension. You got to have some tension in that tendon, in that muscular structure, to get those muscles to be efficient. I mean, it's physics, and you have to look at that as you're repairing that. I mean, you know what I'm saying? Maybe you can talk about that, how you bring those mop ends together, but it's more to it than just that. You're doing a lot of physics in there.
Yeah, a lot of times, there's different ways and different tricks that different doctors will use. Sometimes they'll use the contralateral ankle to understand kind of where it sits at rest. Because, again, you're trying to get this at the correct length. A weird example is like if you're towing something behind you, if you've got a nice fixed anchor behind you, you've got better control of what you're towing. But if you hook it up with like a bungee cord behind you, that ability to like tow that mass and move it and control it is poor. So if you bring the ends together too loose and they heal, that when the muscle contracts, you're not going to be able to control your ankle and your foot. And then you're not going to make, an elite athlete is not going to be able to come back from that. And that's why years ago, when this happened, even to an elite athlete, they would often say that it might be a career-ending injury because they wouldn't be able to jump or land. We talked, I think, a few times ago, I think it was Terrell Suggs.
That's right.
Who had sort of an injury like this, who was like the first one that like came back bigger, better, and stronger afterwards. And that was sort of that turning point with, wow, you know what? Like, this isn't the end for a speed rusher who weighs 280 pounds.
Yeah, it's amazing. It's amazing what they're doing. And I just can't imagine. I'm hoping to still be around and doing this in 10 years, obviously, because I just can't imagine the progress and the advancements and the technology and the research that's going to happen in 10 years. Aidan O'Connell, quarterback, Las Vegas Raiders. I have such a hard time saying Las Vegas Raiders. QB, fractured thumb. I mean, this is my Gardner Minshew team. Gardner came to Washington State several years ago, took the Cougs. I mean, he's pretty well known over on the Palouse. Everybody's rooting for him. He started for the Raiders. He got replaced. But Aidan O'Connor has this fractured thumb going on the IR. That's pretty significant.
Yeah, he had that bad luck injury where, the pressure was coming in hard and he had a contact injury on his follow through.
Yep.
And if people were watching it, the insult to injury part is it was such a poorly thrown ball because of the contact that they actually flagged him for intentional grounding.
Oh my God.
Didn't go back. Yeah, they didn't even go back and realize it was because he got his hand smacked when he threw it. So he hurt himself, had to come out of the game after a play, and he got a 15-yard penalty and loss of down for intentional grounding. So these thumb fractures, they come in all different shapes and sizes. It doesn't seem clear at this point whether they're actually planning to do anything surgically for it. So that usually lends to the fact that, it's a minimally displaced injury. My sources, though, are saying that it's not going to be a 4-week thing. It's going to probably be 6 to 7 weeks till they're going to have him really gripping a ball and stuff. So he's definitely out. He's definitely on injured reserve. I don't want to break the bad news to you about Gardner, but they went out and I think are signing another quarterback. So that tells me that I think they're actually looking to find somebody else to step in instead of bringing Gardner back in as a starter.
At this point,
he's unfortunately, I think. Yeah, when he came in, I think he threw 3 picks and had a fumble in the rest of that game. So,
I know. I feel bad for him. I mean, It was his big shot. It's a big league. It's a tough position, and I can imagine the Raiders. I think they've had a couple losses. I think they started out on fire. I think they just recently signed that coach. I think it was an interim coach last year. They signed him, and I think they're probably in the rebuilding mode at midseason here. So I wouldn't doubt it if they went out and got someone looking at just the future of the club. So, I mean, Aidan O'Connell is out, like you said, 4 to 6 weeks at least. Really don't know what's going on. Fractured thumb, but more importantly, fractured thumb on the throwing hand. That's not easy to come back from if they have to do any kind of intervention there. Oh boy, this is an injury. I mean, you kind of heard about it. I mean, they're doing a good job. Television is doing a really good job when they see these injuries and they break away. They don't show it again. They don't replay it. But when they talked about it and they said, we're not going to show this again because it's pretty significant. This was Monday Night Football. This is Chris Godwin, Tampa Bay Buccaneers. And they were, they're pretty decimated on a receiver already and kind of struggling a little bit. But this guy, I think, was leading the league in receptions as far as the receiver goes. But he's got this dislocated ankle. It sounds like a bad one. It sounds like, I don't know if it was a fracture dislocation or what, but it was significant enough. Like I said, when you see a player going off on a cart and there's an air cast on the leg, first thought I have, and I'm sure you do too, Dr. Hawkins, is fracture. Let's talk about him.
Yeah, you're right. They cut away real quick. And for those people who got that quick moment to look at it, his foot was basically, tilted about 90 degrees further out than normal.
The Dak Prescott injury kind of from going back. Go ahead.
Yeah, exactly. And so they've been a little bit mum as far as the total extent of that, but just based upon the position that foot ended up in, usually you're dealing with, a fracture of the fibula, which is the small bone on the outside part of the ankle, and then that allows, with that fracture to occur, it allows the talus, which is the hinge bone underneath the tibia, to rotate out of position. That's where the dislocation side comes from. So generally speaking, to rotate that far, usually it is the combination of both bone and soft tissue. And so the plan for him is surgery. At a minimum, if he got lucky and somehow that spin, that 90-degree turn happened without a break, they're still looking at a significant syndesmosis injury, ligament injury.
Jeez, yeah.
And so you're looking at that that tightrope reconstruction that we've talked about before. That Tua had back in the day.
That's right.
And that's basically, putting soft tissue sutures through to hold the bones together. But I'm expecting that they probably are putting a plate and screws onto the fibula, and then they'll pass that tightrope device through that. And that's why you're looking at a season-ending injury. Sometimes with just a soft tissue injury, that's where sometimes you see these guys coming back maybe at 6 weeks. But with a fracture and the amount of time it takes for that to heal, that now becomes an 8 to 12 week process. And like you said in the beginning, we're 8 weeks into the season, and that's for a receiver, he's not going to be ready to cut and sprint, until minimum 8 to 12 weeks. So
yeah, I couldn't see, and they didn't say, but sometimes on these fractures, does it make a difference just from your standpoint? Obviously, it's going to. I'm sure when you answer this question, that I've seen it where these fractures actually tear the skin. There's actually the bone actually gets, it's an open fracture, so to speak. I don't think that was the case here. At least it didn't appear to be the case. But as a surgeon, when it's open like that, you got some other concerns that come into play here, don't you? As far as what you're doing in rehab?
Yeah, I mean, it right away, obviously, it's the infection risk. So you expose something to the outside, so you give the option that bacteria is going to get in. So, if something like that happens suddenly, the whole idea that they're reducing it and getting sort of the bone back under the skin right away is important. But then the timing of doing it very quickly, and that's where I think you are correct, that I don't think anything came out, because they're planning surgery, but they didn't do surgery that night.
Right.
So, I think he would have gone to surgery that night if it was an open fracture. But that's part of why reducing it's important, because even if it doesn't come out right away, if you have a significant displacement that pushes up against the skin can get compromised, and that can affect vascularity. And sometimes down the line, that can compromise, the ability for the skin to heal when they actually do the surgery itself.
Wow.
So when they put a plate and screws in, sometimes these guys get horrible swelling and horrible what we call fracture blisters, which are sort of like, large blisters at the skin surface. And sometimes that has to heal before we can then do surgery and operate through an area. So sometimes a bad ankle fracture dislocation might actually have to wait 2 to 3 weeks before surgery just to let the skin calm down, so that when you close it up at the end, they're not at higher risk of infection.
Yeah, amazing. Now, there's times, as we talk about this, what you're suspecting here, what you're thinking is, and you're right, you do a great job here, but they got the lateral side, so the end of the fibula, which we call the malleoli or the malleolar bone, that got knocked off. There are times I don't know if this happened, but that talus, when it whips out, it can also whip back in, and that can cause that medial side or the end of the tibia to be fractured out. And I think do you call that a bimalleolar fracture? Is that at that point when that's got that definition?
Yeah, exactly. It's like, the sides of a box, one side caves in, the other side can cave in as well with it. So, and if that's the case, then, that side also gets stabilized. Right. Usually that's a 1 or 2 screws to hold that other side in place. And quite honestly, if you just have a bimalleolar fracture, the good news about that is oftentimes the ligaments are more spared in that situation because the bone gave on both sides. That's where the displacement came from. So that's sometimes a better prognosis, even though both bones are broken, that there's been less soft tissue injury to that syndesmosis in the middle. So that's a good injury sometimes.
Yeah, okay. All right, here's an injury. We've talked about this a little bit, but he was out of the game at the time. This is Mike Evans. Again, the Buccaneers were looking good. Baker Mayfield, he's on fire. He seems to be doing well with the Buccaneers. He's losing weapons. And Mike Evans went out, I think, in the first half. I think everybody kind of saw it when the injury happened. I think he was in the process of running, and he had a hamstring hamstring strain, and he's out. And it sounds like he is trying to figure out what's going on, and they're trying to work, but he may be out this week. What do you think?
Yeah, I think he's a definite no-go for this week. They held off on the IR designation, but the sources out there are anticipating this is going to be just right at that limit. So I think he's going to be out a solid 3 weeks, maybe be back at week 4. As we've touched on with these soft tissue injuries, this is what you worry about, because he was nursing an issue ahead of time, and he didn't have much contact. He didn't actually go up too high. He just kind of took an awkward stride to get a ball that was a bit of a reach for him, and he immediately, as he went to the ground, was grabbing the back of his back of his thigh. I'm sorry. So, that tissue that had been injured a little bit before, that maybe was knitting, was feeling better, it probably gave a little worse than it had done before. And so he sort of re-injured this. and set himself back, unfortunately, a bit further than he was before. So he definitely won't be in this week. And like I said, I think he will. Unfortunately, he is one of my big players on my squad.
There you go. Sorry about that.
And he lost me this game because he had 9.5. He had 9.5 points at that point, and I lost by a point to my opponent. So all he needed was one more catch in the game. They could have wheeled him out in a wheelchair and thrown him a ball, and I would have won. But anyway, unfortunately, I'm already concerned that I don't have him for at least 3 weeks now. And I think they have a bye coming up, so they'll probably try to get him back after their bye week.
Yeah, good. Okay, Mike Williams, Tampa Bay Buccaneers wide receiver. He's out for at least 3 weeks. Keep an eye on him, maybe at 2, but probably 3 weeks. Thank you. Rashid Shaheed, New Orleans Saints wide receiver. This is something we haven't talked about in a little while. This is a torn meniscus. And I understand that he underwent surgery, but not just surgery, but he underwent a meniscal repair. That's what it sounds like to me. So probably looking at this is season ending. Your thoughts?
Yeah, that's a tough one for him as a player. And this is where it gets really hard, I think, for what we're doing with taking care of both athletes and regular people, is trying to decide that difference between meniscus surgery where you trim it and meniscus surgery when you repair it.
Yeah.
Repairs are prolonged recovery, prolonged restrictions, because that tissue, which is a cushion between the ends of the bone, it's very thin. It doesn't have great blood supply to it. And so when it tears, depending upon the shape of the tear and the location, if we put stitches into that, we have to then rely on the biology to let that heal. And that's not really greatly predictable nowadays. And so back to, what you've brought up so eloquently about progress in the ability to fix things, we now have devices that allow us to put stitches into very small spaces that is not as destructive as it used to be. So we can repair tears in very tight spaces now that in the past we would have said, wow, our instruments are going to cause more damage just trying to do it than the repair itself. So now we can stitch up tears in very small areas, but what we can't do is we can't truly say that's going to guarantee it's going to heal. So again, situations like this, he's a young player with probably an injury that's going to, potentially damage that cushion long term. And so I think there's a decision to be more aggressive with these things to try to get that chance that it could be as close to normal as possible. Yeah. But we really don't have good long-term data to show, is that really working? So it's a rough one. I struggle with this a lot with just day-to-day patients. Somebody like me comes in or you comes in and you have an acute injury and you have a tear in your meniscus and you're like, hey, can we repair this? And it's sort of like we can repair anything. It's just a question of, is it going to work? And that's a hard one.
Yeah. But I think thank you for the information. That's really important. But you're going to go in there as a surgeon. You're going to go in there. You're going to look around. You're going to investigate. You're going to scope it. But you're going to assess it from the standpoint of potential repair. And then most importantly, I think what you have to decide, repair versus removal, is, you mentioned earlier, how do you know there's good enough blood supply in that particular area? Can you see that in the scope? Do you see the capillary beds and the blood flow to that injured area? Are you assessing that? I'm sure you are.
Yeah, that was always the make or break initial decision, was basically, are you in what's called the red zone, which is the vascular area? So you can see blood vessels, you can see bleeding at where the tear site is. And so if it's in the red zone and it's a contained tear, you usually would try to fix that. When I talk about how things are changing a little bit, a lot of the data that's being presented nowadays in our society is like, okay, how many of these ones that are at the junction, what we call the white red zone, how many of those might heal if we fix them? And there's even some people that are proposing that fixing things in entirely avascular areas, that sometimes there can be healing that occurs. And so that's where that little, that barometer is sort of swinging a little bit nowadays, to maybe be a little bit more aggressive in younger individuals who don't have any early cartilage damage and stuff like that. So I could see very clearly where this could be a tear that I would 100% trim in myself, but he's an NFL athlete at a young age with no other cartilage wear in his knee. So they're going to roll the dice on that, even if there's maybe a 15% chance it heals. Okay, if it does, great. If it doesn't, they can trim it out down the line and get him back quickly after that.
Yeah, so, in the rehab process, a repair versus a meniscectomy or a removal is totally different. With a repair, you have to be guarded. You have to have a protocol. You don't want to, get on it, get weight bearing too fast. You want to let it heal. With a meniscectomy, I mean, you're seeing in meniscectomy when they remove this meniscus, you see players come back in 2 weeks sometimes. I mean, you want to talk about that? There's just a rehab versus a repair versus a meniscectomy?
Yeah, you hit it right on the head. If you repair it, you're protecting the weight bearing, you're protecting your range of motion depending upon where the repair is. So when we do those at the same time as somebody's ACL surgery, I will tell the patient afterwards, like, your recovery is actually going to depend on your meniscus healing versus your ACL. Yep. So it's even potentially a longer recovery allowing a meniscus to heal than to let an ACL heal. So that opens their eyes sometimes. They're like, oh, wow, I had no concept it could take that long. And the weird example of, how things change over the years, all of us kind of remember when Jerry Rice, who was the safety for the 49ers, Ronnie Lott.
Oh, yeah,
when Ronnie Lott, destroyed his pinky, and they said, well, we can reconstruct this and, you're out for 9 months, or we can chop it off and you're back in 2 weeks. He said, take it off. I don't use it for anything. So that's a very graphic example of thinking of the difference between trimming a meniscus and repairing it. And so again, you just have to have those discussions with the patients and in this case, the athlete, and take their wishes into account as well. Ben Roethlisberger would have told you to chop his meniscus out because he wants to play the next week. He would have told you that 100%.
Yeah, and as a surgeon, I mean, just for our listeners, I mean, it's again, you're not just repairing the immediate needs of the surgery and the injury. You're thinking about the future, and obviously it's better for anybody to have a full meniscus in that knee to work as a bushing between those two bones. I mean, you want to have your meniscus if you can. Is that right? I mean, you want to try to save it,
exactly.
Essentially. Yeah.
We know that. Yep. Keeping the rim is the most important thing. So, if you have a tear that extends all the way to the edge, then it's like a washer that doesn't seal when you tighten the mason jar down.
God, I like these analogies. Again, I like these analogies. I love it.
Yeah.
Yeah, that's awesome.
Yep.
Yeah. I mean, and for our listeners just out there, I mean, you have to imagine, if you ever get a chance to just YouTube, knee surgery through a scope or something like that. I mean, just look at it. I mean, it's amazing what you guys are doing in there. You're working inside that knee. It's magnified. I just think it's fascinating how you control the tools and the instruments, and then you're doing these knots, and the technology has come so far that you can repair these things, like you said, when you used to not be able to. You're getting into some really small spaces. It's pretty incredible what you can do. I mean, I don't even know how you learn it, but we'll talk about that another time. I mean, next player, Brandon Aiyuk, San Francisco 49ers, wide receiver, man. I mean, again, a couple teams I think of the Buccaneers and I think of the 49ers. I think I told you this. I saw the 49ers early in the season. I was like, who's going to stop these guys? They have so many weapons, and now they just losing them left and right. And he's out. He's got a torn ACL and MCL. He's not coming back. I mean, his season's over, so to speak.
Yeah, he's had that, sort of bad combination injury where, an MCL goes first and then the energy hits the next ligament over and that goes. So, yeah, he'll be out. He'll be out for obviously the rest of the season. Generally with these combo injuries, MCL will oftentimes be treated conservatively with a little bit of short-term protection and immobilization, which makes the presentation and treatment of an isolated ACL injury more predictable recovery. Exact same thing that Saquon Barkley had a couple of years ago, and obviously he's shown a complete recovery. So the good news is Aiyuk should be back. Again, it'll be solid 9 months probably till he's practicing. So if anybody wants him going into next year, if you have what's called a keeper league and you want to pick up somebody, I would just expect that you're not going to have him till like probably week week 7 or week 8 of next year. But unfortunately, you hit the nail on the head. They were unstoppable until they hurt everybody on their team, and now they're stoppable. Yeah,
there's a couple teams like that, but not the Seahawks. The Seahawks, for the most part, I mean, a little bit of luck in this business, this NFL business, because if you get lucky and most of your players stay healthy, that is kind of you're lucky. You're really lucky because DK Metcalf. Here he is. He looked like he was having a great game last Sunday. He looked strong. He caught really a couple nice passes. Then he disappeared. It was like, what's going on? Where's DK? Well, to come to find out, he had tweaked his MCL, and they call it a minor sprain. And, we talk about in medicine, we like to grade everything. But he was out. I don't think he played the second half, I remember. So it must have been significant. Let's talk about that minor MCL sprain, because I think he's probably going to play this weekend based on what I read. But let's talk about that.
Yeah, so they have graded him out as a grade 1 injury, and that's usually where, you have pain with stressing the ligament, but you don't have any instability with testing it. And so that's good news that there's no disruption of the fibers. It's usually a pain-limited thing. The latest thing I believe this afternoon was that, he's officially obviously did not practice today. He's not going to practice tomorrow. And then they're going to see if he feels up, whether they can practice Friday. And that'll be the litmus test day as to whether he's going to get in this weekend. For those who have him on his team, which I have him as well, on my team, I think I'm going to look at that and sort of have a contingency plan. If he doesn't practice Friday, then I think they'll hold him out this weekend. But right now, I think you're correct. I think he's trying to go this weekend. I think they're just trying to avoid irritating it for 2 days with any practice, hoping that his pain's better come Friday. And as long as he doesn't have much pain, then I think that they'll work him back in and have him play this weekend.
So, I mean, I think both of us, I mean, what we know, keep an eye on him, but we're leaning towards play. I believe they have a home game this weekend. The Seahawks are at home.
Against the Bills.
The Bills, that's right. The Bills, that's right. So that's a significant game. The Bills are playing pretty good. Josh Allen's he's a machine, So one last player. I'm not sure how much information. I couldn't find anything. I read about it, but again, we're talking about San Francisco, who has a lot of players out, a lot of weapons out. One of the big guys that they need is George Kittle. I mean, he's an amazing tight end. I believe he's an Iowa product. Like Iowa has all these tight ends coming out of there, but they're very vague. They're just calling it a foot sprain. I mean, there's foot sprain. There's so many bones and so many ligaments in the foot. I don't know what that means, but what do you think? Play, starter, sit, most likely.
Yeah, the quick answer is I think he's going to be a start. I think this is a little bit more of a soft tissue injury. He probably has some discomfort. He has not been immobilized full time. They don't have him going around in a boot full time. So that's an encouraging thing. It sounds like, hey, he's had some pain in the foot. I'm sure they've MRI'd him and they don't see any major structural issues. So this is one of those designations, like we're going to keep him limited in practice. But I think he's the kind of guy that will tend to play through a minor injury, I think, and knowing what his team will need with all of their major weapons being, out and limited. And I think we're still looking at, McCaffrey 3 weeks away from coming back as well. I think Kittle will be a play this week.
I do too. There you go, folks. That is our Starter Sit podcast for looking into week 8. We're talking about, again, we just talked about week 7 injuries. That's Dr. Hawkins. Dr. Hawkins, once again, fantastic job. I so enjoy doing this, and I too learn so much when you describe, and you do such a good job kind of describing things and put it in kind of commonsensical terms, if that makes sense. And we appreciate your time. We appreciate your enthusiasm, and certainly appreciate your expertise in discussing our Starter Sit podcast. Everybody have a fantastic week, and good luck in the games coming up. Dr. Hawkins, thank you.
Yep. Thank you.